Hello everyone. Today our team will present a diagnostic for stroke. In this presentation, we will introduce stroke and explain the rationale behind the development of our diagnostic kit. First, I would like to explain why we choose stroke as our target disease. This figure shows the leading cause of death worldwide. Stroke causes approximately 7.3 million deaths each year. And is the third leading cause of death worldwide. Therefore, we believe that stroke is a major disease that deserves significant medical attention. Stroke is a disease in which brain tissue is damaged due to problem in the cerebral blood vessel. It can be broadly classified into ischemic stroke and hemorrhagic stroke. As shown on the left, ischemic stroke occurs when a blood vessel becomes blocked by a blood clot or atherosclerosis, reducing blood flow to the brain. In contrast, hemorrhagic stroke occurs when a blood vessel ruptures and causes bleeding within the brain tissues. Because these two types of stroke have different causes and the treatment strategy, rapid diagnosis and prompt treatment are essential. The FAST assessment is one of the most widely used methods for stroke screening. Most strokes occur in the cerebrum, which is responsible for motor, sensor, and language functions. As a result, patients with cerebral stroke of development characteristic symptoms, such as facial dropping, arm weakness, and speech difficulties. These symptoms form the basis of the FAST assessment. Because cerebral stroke usually present with recognizable symptoms, they are relatively easy to diagnose in clinical setting. However, not a stroke can be detected using the FAST assessment. In particular, cerebral ischemic stroke is known to be more difficult to diagnose. Patients with cerebral stroke of present with non-specific symptoms such as dizziness and vomiting, which are also common in other vestibular disorder. As a result, cerebral stroke is often misdiagnosed in the early stage, lead to delay in diagnosis and treatment. In addition, studies have reported that approximately 31% of patients show negative MRI finding within the first 24 hours after symptom onset. Therefore, a faster and more objective diagnostic method is needed. In addition, the FAST assessment have limitation in unconscious patients or those with atypical symptoms. Furthermore, CT and MRI, which are currently used for stroke diagnosis, are expensive, have a limited accessibility, and may lead to delay due to emergency department waiting time. Therefore, we aimed to develop a simple diagnostic kit that can rapidly screen for stroke, using only a single drop of blood regardless for location. In addition, the kit is expected to be cost-effective and suitable for repeated testing, allowing continuous monitoring of patient status and treatment outcomes. Next, I will explain how we selected the biomarker for our diagnostic kit. Several candidate biomarkers have been proposed for stroke diagnosis, including D-dimer, NSE, and GFAP. However, D-dimer has low specificity for brain tissue, while NSE does not increase sufficiently during the early stage of stroke. In contrast, GFAP has higher brain specific and is more directly associated with brain injury than the other candidate biomarkers. For this reason, we selected GFAP as the final biomarkers for our diagnostic kit. However, GFAP is present at very low concentration in the bloodstream, A highly sensitive detection method is required.
This diagram illustrates our sensitivity enhancement strategy. In Figure 1, without GFAP, metal ions remain dispersed, resulting in high impedance. However, in Figure 2, with GFAP, target protein captures gold nanoparticles on the test line. This forced metal ions to align between the electrodes, create a low impedance path. Our detector captures this change, achieving much higher sensitivity than conventional LFA. Then why choose AC over DC? DC causes ion polarization, leading to signal decay and gas bubbles that block the membrane. In contrast, AC keeps ions oscillating, ensuring a uniform distribution. It also prevents electrolysis, so no gas bubbles are formed. Therefore, AC is our choice for stable, high precious quantitative analysis. We designed a single supply closed loop for our portable device using the battery's negative terminal as the return path. By using a virtual ground effect, we ensure no DC bias is applied to the LFA kit. This allows only pure AC current to flow, which completely eliminates gas bubble evolution at the electrodes. We choose silver because it has 1.4 times higher electrical conductivity than gold. This significantly amplifies the dynamic range of our impedance signal. Although silvers have challenges like oxidation, we address them through proper packaging and optimized washing. Thus, silver provides the best balance of analytical performance and cost effectiveness. In this slide, our protocol consists of 5 steps to verify impedance change. At first, we contrast a test line and immobilize anti-GFA capture antibodies. Second, we prepare GFAP standard solution at various concentrations. After that, we introduce a react metal particle conjugated with detection antibodies. Then, after washing, we measure the impedance between the electrodes. Finally, we plot the impedance change as a function of GFA concentration. Silver nanoparticles have two main issues: oxidative dissolution and colloidal aggregation. Exposure to light and oxygen causes oxidation dissolution, while buffer electrolytes lead to particle aggregation. Since this issue compromise reproducibility, buffer optimize is essential. We optimized our buffer to ensure stability. For the sample buffer, we use 0.1% BSA and 0.02% 2020 to reduce background noise. For the conjugation buffer, we use HEPES instead of PBS to prevent aggregation. We also added 1% BSA for coating and 5% sucrose for protection while keeping the flow rate optimal. Finally, this slide highlights our clinical and technical goals. Clinically, we offer a rapid stroke test using just one drop of blood, helping doctors save critical treatment time. Technologically, we provide a robust reliable biosensor platform that ensure stable and reproducible result. And thank you for attention.